Now to a tragic story out of Milwaukee. A 10-year-old boy accused of shooting and killing his own mother.
The child is being charged as an adult with first-degree homicide. That's according to court documents. The boy said he was mad at his mom for not letting him buy a virtual reality video game headset.
But there's so much more to this story. The family says that the child had been dealing with mental health issues and meeting with a therapist.
Sarah McGrew talked to an organization that provides intensive mental health services to children and adolescents. Sarah?
Yeah, it's shocking to hear about such a young child having severe mental health issues, but at Strong Milwaukee, it's what they see and work with to help daily.
We are still trying to learn more about what happened in this neighborhood where police say a young boy killed his mother. The criminal complaint says the boy has multiple imaginary people that talk to him, is prone to rage issues, and was seeing a therapist. Family alleges that he showed no empathy or compassion when apologizing for, quote, killing my mom. Strong Milwaukee, a mental health organization, did not treat or want to speculate about the 10-year-old's case, but they are familiar with severe mental and behavioral health issues among children.
Here at Strong, we see a lot of children with attention deficit hyperactivity disorder or disruptive mood issues. Really any significant anxiety or depression as well.
Ashley Schoof is the clinical director at Strong Milwaukee. The kids she and her team treat range in age from 4 to 15 and often have some of the most severe cases, including violent behavior. There's even been cases where Dr. Schoof says children have to be hospitalized.
Typically that is when children display an imminent danger or threat to themselves or others.
She says in severe cases, early intervention is key.
Making sure that we can get any sort of behavioral disruption or emotional regulation issue as quickly as we can. It's much easier to treat those things, even if they're little things, very early so that they don't turn into very large things.
Family of the young boy told police that he had received a, quote, concerning diagnosis from a therapist. According to the National Alliance on Mental Health, 1 in 6 kids from age 6 to 17 experience a mental health disorder each year. So how do you know if it's time to seek professional help for your kid?
It can be anything a kiddo is struggling with that is out of the ordinary for that child. Start finding help when they are doing the coloring on the wall and they aren't listening to you to stop. You've tried all that you think you can, and nothing has worked.
And the National Alliance on Mental Illness notes that 70% of youth in the juvenile justice system have a diagnosable mental health condition. You can head to our website for some resources on childhood mental health. Just search mental health. Sarah McGrew, TMJ4 News.
An important topic to talk about. Sarah, thanks.